Good evening, the members of Montgomery County Council. My name is Shage Kakesh. I also go by Denise, and I am, excuse me, a student of public health at Columbia Southern University, and I'm pursuing my master's degree. I am going to present an issue that we are facing here in Montgomery County, Maryland, which is environmental health disparities. So, environmental factors such as housing conditions, air quality, and neighborhood designs can directly affect people and their health. And unfortunately, in those low income families or residents and communities of color, um, there are a higher rate of pollution. And those communities also get less access to green spaces, and they have a higher risk of respiratory diseases. In this presentation, I will try to outline who is most affected by these disparities and what interventions already exist, what gaps exist, and how we can improve those policies for a better health equity among our county. So, environmental health disparities arise when a particular group experience more harmful environmental exposure compared to others. According to Montgomery County's Air Quality and Hotspots report, Black people and people of color are more likely to be exposed to higher levels of pollution compared to white residents. And these communities have a higher risk for diseases such as asthma, cardiovascular diseases, and pollution-related diseases. Disparities are especially visible in areas such as Germantown, Gaithersburg, Wheaton neighborhoods with a higher pollution rate. So, who is affected the most? The low income household and ethnic minorities, and unfortunately, children are the ones who are most affected by these disparities. So, we need to address those when we need to take action. The health in Montgomery County from 2013 to 2022 report shows that asthma emergency department visits are higher among Black children compared to white children. Additionally, those neighborhoods with more minority residents have less access to green space and higher heat exposure, which increases the risk of heat-related illnesses during summer. These patterns all show clearly that environmental risks often can overlap with social vulnerabilities. For example, education gaps, limited healthcare access, and poverty can definitely affect people's health. So, why do we think these disparities matter? Because environmental disparities are not just about pollution, it's about justice. And as a 2024 study by James Todd emphasizes, an environmental health perspective shows that both researchers and policymakers must and they need to ask why these disparities still exist and why we still face those, rather than just documenting them. So, Montgomery County has made lots of progress through plans such as Climate Action Plan and Green Streets program that focuses on emissions and improving stormwater management, but there are still some gaps which needs to be filled. To address those disparities in an effective way, we can apply public health problem solving methods such as the socio-ecological model, and we can use those frameworks to emphasize the interventions at multi-level, such as individual and community level. And the key here is communication, because communication should be transparent, should be culturally relevant, and inclusive. Most of the health updates are either on newsletters or websites, which makes it hard for people or residents who have limited access to internet or Wi-Fi to be able to read those or be aware of those. So the county can use text alerts, local radio announcements, and ambassadors in multiple languages to make sure everyone hears and understands what they need to hear and understand. In conclusion, environmental health disparities in Montgomery County are tied with social and environmental equities. Those disparities are affecting vulnerable people and they have to be addressed. And the county must adopt solution-oriented strategies to make sure we can go beyond documenting everything. Thank you for watching and putting the effort. Have a great night.